An otoplasty is done for a person who has prominent ears. That's essentially the indication for it. During the whole embryologic development, there's a lot of pieces that come together to make the ear, and then the cartilage folds to give you what we would consider a normal appearing ear. If a person's born with that and that cartilage hasn't folded properly, oftentimes if it's picked up right at birth, it can be corrected with just molding and avoid needing surgery. Fortunately, if it's not done early after birth, the cartilage is going to form in that abnormal appearance, and then it's going to require surgery to basically reconstruct and make the cartilage have the normal folded appearance. You're typically going to wait until the ear is kind of fully grown, so typically around the ages of 4, 5, 6. Once they start getting older than that, they're going to start to get teased and become more socially conscious of it. So we typically try to wait until the ear is a little bit bigger, but still young enough that they're going to avoid all the kind of the teasing and the adolescent stuff that happens. It's not that uncommon to see a teenager or even adults that either for whatever reason are unaware of it, or their parents have decided that they don't think it's important enough to have done. And then oftentimes we'll see them as young adults or teenagers that will come to have that corrected. Success in otoplasty would be having a patient whose ear basically looks normal again. Oftentimes you're going to still have some minor differences between it, but most people don't notice them because when you're looking at a person, you're often going to see them from one side or the other. But the whole goal is to get so that the ear isn't prominent, so that they can wear their hair in a normal style, not be self-conscious about the fact that their ears are sticking out more than everybody else's. Board-certified plastic surgeons are going to have a broad training, are going to be specialized in taking care of kind of knowing what the normal anatomy and embryology of the ear is, and then can correct the various deformities that can cause the ear to look abnormal. Oftentimes otoplasties are going to be done through incisions behind the ear so there's no visible scarring. So as long as you have a board-certified plastic surgeon that's gone through all the training and has continued to practice doing otoplasties throughout their career, they're going to tend to give you the best results.